Plastic surgery was never my goal when I went to medical school. In fact, I thought I was going to be a transplant surgeon. I was enthralled with taking something that worked on somebody and giving it to somebody, an organ that it didn't work in. And I went through Duke and actually did the first immunology graduate school. And then I went to University of California, San Francisco, and I was working my way up to be a transplant surgeon. But something unique happened. I was just about to leave the surgery department and do my anesthesia rotation and my pathology rotation when two of the young plastic surgeons had to take a leave of absence. They just told me I had to be a plastic surgeon for the next 6 months. And what that started was a love affair of restoring disfigurement, enhancement, and it changed my life. Most people don't know the new crop of plastic surgeons haven't done general surgery. And so I'm a board certified general surgeon as well, because you have to be a general surgeon before you're a transplant surgeon. So I've done gunshot wounds to the chest, I've done colon cancers, I've done appendectomies, I've done liver transplants, kidney transplants. I've run the surgical intensive care unit, I've run the emergency room. I have a lot of surgical training and medical knowledge that I think translates directly into patient care.
I think what endeared me to Dr. Weiss was the fact that he was so compassionate, so caring, so warm, more so than I think any physician, certainly surgeon, I'd ever met in my life. I had no fears, no hesitation whatsoever with him or the surgical experience. I knew I was taken care of by someone more than capable of performing the surgery. And he's not disappointed me in the least at any time.
With any operation, there's always, nervous excitement. You are expecting a certain outcome. There's always trepidation about surgery. So I try to take my time and educate the person on what to expect from the minute they get, to the operating suite to 2 months afterwards. Everybody has my personal cell phone number. They can call me 24/7. I'm calling them, in between office visits to make sure they're feeling well, and I take care of them.
It was great from the first consultation all the way through the work to the follow-up. He's very attentive. He checks on you. I've never been more comfortable with a procedure. He has great bedside manner.
Dr. Weiss made me and my husband, who came with me for the consultations, feel very comfortable. After the surgery, he called to make sure that I was okay and helped me feel more comfortable that way as well.
I do see myself, as a physician, doctor, healer. My dad was a physician. I used to go to the hospital with him. He was a guy that still made house calls. My mom was a counselor. So I think I grew up in a family that took care of other people. And I think that translates into a whole mindset of how I approach medicine.